And you found the office okay, too. Good for you. Good for you. You know, I can never tell the back of my hand from the back of my foot. Alright, hold on. I gotta get my glasses out because without them I can't see. Alright. So, okay. Let's take a look here. So, okay. So you're here today because you're having some concerns about some acne. Oh, yeah, I can see it. You got some going on just along the jawline, the chin, and a little bit going on in the forehead, the hairline. Is there anywhere else that I can't see? Okay. So, if you try putting any medication on it, any attempts at extracting the pimple yourself at home? Okay, good. I always want my patients to leave those for me because you never know. You don't want to introduce more bacteria or risk spreading the bacteria around. It just turns into a cycle, and who needs it? So, okay. How about you tell me about your skincare routine? What kind of products? What time you use them? Tell me all the details. I like the information. Okay. Oh, I like that brand. Good, okay. And how about a little SPF? Are you putting on some sun protection before you go outside? Okay. You want to use that every day, even if it's cloudy and raining, and I'll tell you why. The reason being is that even if the UV index is low, it keeps you in the habit, which is very important. And, okay. Do you have any allergies that you're aware of? How about food? Okay. And, okay, looks like you were sent here by Dr. Cozy. I'll make sure to send her a little thank you card along with a copy of our notes from our visit today. Okay. Okay. So have you ever used a prescription acne product in the past? Just over the counter? Okay. That's fine. Honey, I'm gonna have to get real close because I cannot see. You're okay with me touching your face? Okay, we always like consent. So, alright. Here we do that whole region up here. this. Acne along the jawline is very likely hormonal in nature. And I am seeing some cystic ones, which I know those are pretty uncomfortable, yeah. I understand. Just want to take a look at the ears because it's very common to sometimes develop some acne in this particular area. Because the ears do produce quite a bit of what's called sebum. Well, yes, looking good. I'm not seeing anything there. Tell me, when you wash your hair, you're using some conditioner. Where on your hair you putting it? Okay. You always want to avoid sort of the area of the scalp. And also, after you wash it out, you want to kind of rinse off your back again with some soap and water, because the conditioner sometimes, and it depends on the brand, can actually clog the pores and cause breakouts if you're not careful. And most people don't know. Okay, so we do have some filaments on the nose. That's normal. I think everybody has those. And let me grab my little magnifier here. Now, honey, this has a light, and if it's too bright for your eyes, feel free to close them, okay? I just need to get a closer look at the pores, and God knows there's no way I'm gonna see them without a magnifier, so. So we do have some enlarged pores kind of in the areas by the nose. It's a common place to see them. Few coming down on the chin, that's fine. And a little bit of pore enlargement between the eyebrows. So, honey, I have this diagram here. We actually use it for the injectables to kind of show people about how aging can affect the skin and the appearance of the skin because of the shrinking fat pads. It's a whole thing, but that's not what you have. So, you have acne right along this region, under the chin, and up, okay? We also are seeing it in the hairline, going across, a little on the temples, okay? And then you have those comedones on the chin, the enlarged pores, Alright, that's what I'm able to see on my exam. So we can treat all of those. However, I would like to do extractions going along the chin and on the hairline. I am going to leave these areas alone due to the fact that that skin is quite delicate and it's very close to the eyes. Alright, and I will provide you with a medication prescription, okay, that you can use for these areas. So, put you back. Alright, one more thing I want to check, and then we'll get into it, okay? Which is, I just want to check the elasticity of your skin, alright? So, I'm gonna feel me kind of tugging it, alright, just like so. I'm just trying to make sure it pops right back. What a face. Alright. Alright. So, what I'm gonna do to get started with you, okay, is I'm going to activate a little heat pack like we have right here, okay? And that's gonna help and encourage the pores around the areas with the acne to dilate, which should make the extractions a bit more comfortable for you, okay? Okay. So, I just picked this part. Always makes me nervous. So I'm gonna wrap it in a little paper towel because we don't want it getting too hot, okay? And I'm gonna start just by holding it on your forehead, just like so. Is this okay? It's not too warm. okay? And we're just gonna do the chin too, okay? And how's that? How's the temperature? You alright? Okay. Don't hesitate to say anything. I can absolutely put another paper towel on top, okay? We don't want to burn you. Alright. The chin is usually a little bit more agreeable in terms of dilating the pores. So, this particular situation is the only time I recommend putting alcohol on the skin. It dries it out, but it's really important when we're dealing with acne, particularly like this, that we remove as much possible bacteria as we possibly can, okay? So, just gonna give your forehead a little swipe, and we'll turn it over. Alright. And we got one for your chin. Okie doke. How are you feeling, honey? You feeling okay? It's okay to be nervous, but I promise you, it's gonna be a lot easier than I think you might realize, and it'll be over before you know it. So, let me get a couple of tissues ready here. One for my instrument, and I'm gonna get another one so we can watch it. I'm gonna start with this one, so I don't want there to be any surprises. Okay, so this does have a little bit of a pokey kind of needly end here, alright? And then we have our little loop, which we use to press around the area. and help it to expel its contents. And then, in case I need it, I do have these little tweezers we can use to kind of help the process along, okay? So, I'm going to put these to the side. Grab a tissue. And I think we're going to start on the forehead, okay? So, I'm going to get myself really, really close to you, okay? Because we want to make sure that we're able to see really clearly. So, okay. I'm going to hold my tissue up. I know this part isn't the best, but we gotta make sure we get everything out. That one's gonna need the tools. Okay. Got one more that I'd like to do. The rest of these, the ones that don't have a head, we're going to leave those alone and let the medication that I'm going to prescribe you take care of that, okay? Because you're going through enough here. don't want to irritate anything else up there. It's already been through enough, you know. We only need to deal with so much, my God. There's always more, isn't there? Alright, so now we're gonna address your chin, okay? You doing okay, honey? Good. Personally, I think you're great. I think you're doing great. You're a great patient. There's no screaming or fidgeting. You're staying nice and still. That's all I can ask for. Alright, here we go. Ready? You're still doing okay? Okay, good to hear. I don't want to be torturing you. It's not the goal here. I just want to help you get some more comfortable skin, you know. And I know when we got acne like this, particularly the cystic kind, or when it's this full, it can be pretty uncomfortable. Okay. Taking a look here. I do think we could probably take care of a few of those comedones. Let's check if this is still warm. Oh yeah, we still got a little heat here. So I'm just gonna place this over the chin for just another minute, okay? The temperature is still okay for you? Okay, good. No, I'm not gonna do the area on the nose. That we can take care of with medication and some good hygiene practices working together. There's gonna be a little bit of pressure here, okay? Well, it looks like I think we got everything. Let's move this out of the way. Sorry about the light again, honey, but the thing is I need to make sure that we didn't leave anything behind because that can spread the bacteria. And then it doesn't get better. So we can't be lazy with these things. Alright. So what I'm gonna do is I have this little ice roller. It's very cold, okay? And it's gonna help encourage those pores that we dilated to close back up tight, okay? Okay, so you're gonna move your hair back here. All right. Okay. So then I have a little restorative skin complex we're going to use. Okay. And we do have this in the front with the rest of our products that we have that are over the counter. But you don't necessarily need it. This is just my treat for you today to help calm down some of that redness. Alright. I mean, if you do like it, you're more than welcome to go and treat yourself. I just don't want to make you think that you have to do anything in terms of the boutique in the front. So, okay. Now what I'm going to do with you is just a little bit of some lymphatic drainage, okay? Very light, very gentle. And I think it's going to help quite a bit kind of calm what's going on, at least in the chin. So, we're going to, oh, there's a little fuzz. I don't know how that got there. Okay, so we're going to use this restorative neck complex. It is by Elastin Skincare, just like the other one we just used. And what this one does, allegedly, is it helps encourage the skin on the neck to stay nice and supple. I thought I saw a hair. Evidently, I'm hallucinating. So anyway, this is something you can do at home, and it doesn't have to be so fancy. You can just use a little, whatever moisturizer you have that's non-comedogenic. So what you do is you're gonna kind of lightly activate the corner, and then I like to focus on one side at a time. So you're going to very lightly, light strokes. About 10 to 20 times. And you're going to follow this path that I'm doing, that I'm working right here. You're going to follow it. And activate the bottom. And you're basically just breaking up any kind of stagnation, because unlike our blood circulatory system, the lymphatic system doesn't have pumping action. So sometimes we're going to help that along. Alright, I'm going to do the other side now, honey. Alright. Let's take off these clothes because they're a little bit on the slimy side. Alright. And we will close up shop with you. Like I said, this one also we have out in the waiting room. You don't need it, but if you're one of those people who likes to have some products, you're more than welcome. We definitely have a few in stock, okay? So, check back where we went. And alright, so we're gonna talk about maintenance, okay? Because we don't want you having to come back here all the time to get more extractions. I also don't want you doing them at home because we don't, like I said, we don't want to risk spreading bacteria around. It can lead to a far more intense breakout, infection. Who needs it? So, here's what we're going to do, okay? I want you to keep up those practices with the washing the face twice a day, okay? For right now, let's forget the serums. Let's just focus on getting the acne under control. Alright, is that okay? Okay. Now for you, I'm going to prescribe 2 medications. The first one is a little clindamycin. It's a topical antibiotic, and you're going to put it on your breakout areas in the morning and in the night. And you shouldn't need to put a moisturizer on top unless you want to. It's not going to dry the skin out, okay? If you do put a little moisturizer on top, I want you to make sure it's fragrance-free, and on the label it says non-comedogenic. We also want to make sure that there's no possibilities of it containing parabens, because those cause cancer. We don't want it, okay? Okay. Now, the other one I'm going to prescribe you is called retinoin. It is a retinol, and that one might dry you out. So what we're going to do is use that one only once a day, every other day, not every day, okay? What did I just say? Repeat it back to me so I know you know. Alright. Bright as can be, this one. Alright, so you can put a little moisturizer, just like I said a moment ago, on top of the retinoid areas, because that one can dry you out quite a bit. And while you're using that every day, but especially while you're using that, you're going to want to use sun protection at least 50 SPF, because it's going to make you way more susceptible to getting a burn, okay? Okay, so I'm going to write you up a little prescription. Let me just make sure we have a pharmacy for you. Okay, so it looks like we're doing the Northtown Kroger. That's correct. Okay, good. So then, let's write it up. right. So, honey, we are gonna get these called in for you to your pharmacy as soon as I step out of here. I'll give it to one of my assistants. We'll have them call, okay? And hopefully that should be ready for you in a few hours. These are medications that pharmacies always have in stock, so I'm not worried. I know it'll be today, okay? Okay. I did give you 3 refills on each, alright? So that way, even after the acne you currently have clears up, you have another breakout, you're prepared, alright? Okay. And then I want to see you back in my clinic in 6 weeks. We're going to check in with each other again and see how it's going for you, alright? Alright. Good. How are you feeling about all of this? Feeling okay? Good. Alright. Well, I'm going to go get these taken care of. Take your time getting out of here. There's no rush. We got plenty of exam rooms, okay? Okay. And I'll see you back 6 weeks.